As a technician in training, I've observed how the people of color in my community have terrible experiences related to healthcare.
One of the huge issues I talked about was the gap between high-income and low-income people in terms of healthcare. I do not think your salary or your income should be a determining factor in whether or not you receive the healthcare that you need and whether or not you get the medicine that you need to be healthy.
I believe it is my job not to ignore what we're facing, but rather do something about it.
I want to become a pharmacist so that I can give patients the attention to their medications that they may not receive from other healthcare professionals.
There are several causes for these disparities, including a disproportionate lack of transportation to medical care and a lack of access to a regular healthcare provider.
There is often a healthcare workforce shortage in rural areas, and specialty services are commonly unavailable, leading to many people needing to travel great distances to receive proper treatment. This leads to people not seeing their doctor as often as they should, or not seeing their doctor at all.
Pharmacists can utilize existing telehealth platforms to reach those without a primary care provider or who lack transportation.
As the Hispanic population grows across America, it highlights the need to bridge communication and barriers.
I think it would be great if all big corporation pharmacies, they can provide their employees with a free Spanish boot camp before hiring of at least the most common interactions found amongst Hispanic or Spanish patients.
Text-to-speech apps should become integrated into pharmacy workstations to help technicians and pharmacists discuss medications with patients. This simple technology can improve medication education, access, and adherence by facilitating an essential conversation.
The app could even incorporate a patient's insurance plan to provide insight on where to get their prescriptions at the most affordable cost, or list a warning for which medications are not covered or need prior authorization.
I was born and raised in a very small rural town comprised of basically nothing except for houses, 2 convenience stores, and wide open land. I find it important to illustrate this because my decision to pursue a career in pharmacy is highly inspired by my upbringing.
I firmly believe if we take all these steps and even more, we might be the generation that can see health disparities in my community that has given so much to me diminished. And that is something I cannot wait to be a part of. Thank you.
I look forward to becoming a licensed pharmacist and beginning to make a difference in my own rural community. Thank you for considering me to receive this generous scholarship.